Hello everyone, welcome to a module on the renal system. In this module, we will talk about the endocrine functions of kidney. Okay, so we all know about the different endocrine glands in the body, that is the pituitary gland, the thyroid gland, the parathyroid glands, the adrenal gland and so on. But we barely talk about the endocrine functions of kidney, correct? Now, in this module, we will talk about the different hormones secreted by the kidney and various functions of the kidney in the endocrine aspect. Hence, it is a tie-in with the endocrine system. So, the different kind of hormones that regulate is erythropoietin, calciferol, prostaglandins, and dopamine. Is it clear? Let us first start with erythropoietin. Erythropoietin is released by the interstitial cells in the peritubular capillary bed in response to hypoxia. Okay, so it is basically released by the interstitial cells in the peritubular capillary, which is present in the proximal convoluted tubule, and it is released due to hypoxia. Okay, so the primary reason for release of erythropoietin is hypoxia, and 80% of erythropoietin released in the body is by the kidney. Is it clear? Now, what does erythropoietin do? Erythropoietin stimulates red blood cell proliferation in the bone marrow. So, what does it do? It stimulates the proliferation of red blood cells in the bone marrow, and if there is a chronic kidney disease, that means a decrease in the nephron function, it can lead to decrease in the erythropoietin, correct? Now, due to decrease in the erythropoietin, it can lead to something called as anemia, primarily normocytic anemia. Am I clear? So, a decrease in the renal function can lead to normocytic anemia, primarily caused by chronic kidney disease. Now, when the erythropoietin secretion increases, it can lead to hypertension. Am I clear? So we are done with erythropoietin. Now let us talk about calciferol, that is vitamin D. Okay. So what does kidney do in functions of vitamin D? It converts calcidiol, that is 25 hydroxy vitamin D, into calcitriol, which is 1,25 dihydroxy vitamin D. So it converts calcidiol into calcitriol by an enzyme, that is 1-alpha hydroxylase. Now, where does this take place? It takes place in the proximal convoluted tubule cells. Is it clear? And the calcitriol formed by the proximal convoluted tubule cells is the active form of vitamin D. Is it clear? So, one more thing to add on is parathyroid hormone released by the parathyroid gland promotes this process of conversion of calcidiol into calcitriol. Am I clear? So we are done with erythropoietin and calciferol. Now let us talk about prostaglandins. Okay. Now prostaglandins are the paracrine secretion which acts as a vasodilator. Okay. It primarily vasodilates the afferent arteriole. Now, since the lumen of the afferent arteriole dilates, a lot of blood can now pass through it, correct? And hence, it increases the renal blood flow. Is it clear? So, it is a paracrine secretion which acts as a vasodilator of the afferent arteriole. Now, prostaglandins are inhibited, or their production is blocked by non-steroidal anti-inflammatory drugs. So NSAIDs like ibuprofen blocks the production of prostaglandin in the kidney. Now, since prostaglandin is responsible for vasodilatation, NSAIDs will then cause vasoconstriction by blocking prostaglandin synthesis. Is it clear? Now, because of decrease in the renal blood flow via vasoconstriction, it can lead to acute kidney injury. Now, since there is a low renal blood flow state, it can lead to acute kidney injury, primarily pre-renal azotemia. Is it clear? So, we have covered erythropoietin, we have covered calciferol, and we have covered Prostaglandins. Erythropoietin is secreted by the interstitial cells in the peritubular capillary bed. Calciferol, that is the conversion of vitamin D into its active form, is done in the proximal tubular cells, and prostaglandins are secreted at a paracrine secretion. Is it clear? Now let us talk about the last endocrine function of the kidney, which is dopamine. Okay. Now dopamine is not just related to brain, but also secreted by the proximal convoluted tubule cells, and it promotes natriuresis. Now what is natriuresis? Natriuresis is excretion of sodium ion with water. Is it clear? Now there are two types of functions of dopamine. One is at low doses, it acts as a potent vasodilator. So it dilates interlobular arteries, afferent arteriole and efferent arteriole. But that happens at low doses. And at low doses, since it dilates interlobular arteries, afferent arteriole and efferent arteriole, there is an increase in the renal blood flow. Is it clear? But there is barely any change in the glomerular filtration rate. Now this is about the low dose aspect of dopamine. When dopamine is present in high doses, it can act as a vasoconstrictor. Is it clear? So this is all about the kidney endocrine function. Am I clear? Thank you for watching this video. If you enjoyed the video, please click on the like button and do subscribe to this channel. Let me know in the comment section below which topics do you want me to explain. Thank you.